Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself. Welcome back to the Beauty Equation. I'm Dr. Christelle Oliver-Dussault.
I'm Dr. Harpreet Lotay.
And I'm Amanda Manholt.
So the last few episodes, we talked about what to do when you feel like you look angry or when you have that resting bee face. And there's a few tools that we went through and explained why that happens as we get older. And today we're going to explore a few different facial attributes that also tend to appear as you go into your 40s and 50s. So Amanda, what's one of the common complaints that people come into you with?
That they look sad. It's a very common change that happens as we start to age and the anatomy and structure changes. But yeah, oftentimes people say to me, people are asking me, what's wrong? What's wrong? Are you okay? And they're literally, like I said, just thinking about, I don't know, they need to take the car in for an oil change. But, when they're not grinning at people, they can have that impression of looking not so happy.
And a lot of people say, I sort of have to force myself to constantly be smiling, and that gets a little old. So constantly focusing on keeping the corners of their mouth upturned, which feels unnatural to them, but looks neutral when other people look at them. And it's funny how the human brain is so tuned to the very minute changes in facial expression. It's one of the first things that babies sort of learn, that when a brow is furrowed, what does that mean? And we're just innately tuned to that. So as the corners of our lips sort of start to fall down, it's perceived as sadness. So there's various anatomical things, as you said, that happen that we'll get into that make that happen. And there's some solutions related to that too.
Are we going to talk about dun 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 lip filler? Don't make me look weird.
Potentially.
Yeah,
Anytime you
look
say filler and lips, I think people get scared, right? They think
they
of
totally freak out. Yeah,
duck
it's bad
lips.
enough when you say filler. It's another thing when you talk about when
Yeah.
we could add some volume to the lip, and they all
Yeah.
panic.
Well,
But I
I mean,
find it's interesting when you ask them then to bring up a photo of them and say they're 20s and they're into you in their 40s and 50s, and you can objectively see how much their lip volume has shrunk. And also the surrounding structures have shrunk too. You don't have the same support around your mouth. And when they see that, sometimes the penny will drop and their guard may go down a little bit and be like, okay, I might be open to this. Tell me more.
yeah, absolutely. But I think that if sadness is really the key emotional attribute they're seeing in the mirror, there's an easy first step, or a less permanent first step, let's just say, which is using Botox to treat the muscles that get stronger at the corners of the mouth that tend to pull the corners down. And we've talked about how effective Botox is as an aesthetic treatment. And one of the reasons that I love it as a physician is that it's not permanent. And if you don't like it, it goes away. And it's really hard to harm people. So, first do no harm. It's hard to hurt somebody with Botox. So it's a great first intervention. It'll just make those downturn strong muscles loosen up a bit so that it's easier to smile and you don't have that subtle emotional attribute showing through.
Yeah. It's one of the treatments I've really enjoyed on myself, because that's one of the findings that naturally, and we're all the women in my family are like this, the lips, the corners of the mouth, even when I was younger, naturally downturned. But what was interesting, how you mentioned that you feel like you're constantly smiling, it feels unnatural. Initially, that's how I felt, because the muscles that pull the corners of the mouth up were very, very weak. And I constantly felt like they were on because the muscles that pull the corner down were knocked out. And it's something
that I've gotten used to over time, and I usually warn patients about that if they're because it will be it's an odd sensation if you haven't had it done before, and if those muscles that make you smile have weakened over time.
Yeah, absolutely. Because perioral muscles or the muscles around our mouth are really involved in so many different aspects of our being, not only speaking and emoting, but also eating and chewing and so forth. And if you tend to activate those downturned muscles more, then you'll miss them. You'll notice their absence or absence of strength. And it's interesting that you say that many people in your family have that tendency. And that tendency can also be structural. Because if you have a shorter chin, and if everyone in your family has a relatively shorter chin, the mentalis or the chin muscle and the DAOs, or those muscles at the corners of the mouth, are inherently going to have more tone than people who don't have the chins that are as short. So it's an interesting little phenomenon that happens. And then your aging trajectory, if you have a shorter chin, will be predictable in a different pattern. And you might be the person that comes in at 35, 40, 45 saying, I look sad and people keep asking me what's wrong. So, yeah.
So would you say SAD is predominantly a lower face issue?
I think so. However, sometimes you see it in people whose eyebrows tend to slope downwards
Yeah, I think
structurally.
sometimes the temporal volume loss when they start to get more of a droop.
Yeah, yeah.
And certain
But
eye
sometimes,
shapes have
y-
a sadder appearance when
yeah.
they kind of so the outside of your eyes is set a little bit lower than the inner bit of your eye, and that's just how people are born that way. That will give that
Mhm.
appearance of sadness. So
Yeah, absolutely. So eyes can definitely impact that as well. And then we can use Botox to help sort of, lift the eyebrow and release some of the muscles that pull the corner of the eyebrow down a little bit. So definitely that plays into it. But I would say between the two, I feel like the lower face seems to be a little bit more impactful, or at least
yeah,
something that brings people in. Because if you have a natural eye structure that's a little bit canted or looks a little bit sad, it's something you've had since childhood and it feels
Yeah.
a part of you. And
Yes.
it doesn't change quite as rapidly as the lower face aspect does when it comes to aging. Um, but to your point, Amanda, if you are quite lean and temporal volume loss starts to play in, at that point, yes, maybe the upper eye will start to be noticed as contributing to that for sure.
I think lower face Botox is kind of one of my favorite things because there's so many different things that you can address and treat. It's a very complex part of the facial anatomy. Um, in terms, maybe one of you could talk a little bit about how it's not necessarily a treatment for beginner practitioners and why is it a bit of challenging, even though if something went awry, I mean, it would be horrible, but it's not permanent. But
Mhm.
it
Yeah. So
takes
like it'll wear off, but one of the tricky bits, and I know I've encountered this side effect, I'm pretty sure most practitioners have at some stage, is we have the muscles at the corner mouth that you've heard mentioned, DAO, that pull down, but really close to them, you have muscles called the DLIs. And they overlap. So knowing your anatomy is really important. And the anatomy varies quite a lot based on individuals. And certain markings can help. But the location of the injection depth really matters in this area. And if you're off just by a little bit, you can end up it can change your smile. It'll almost look like one part of you smiling, the other one isn't. And
it can
same
make it
with
really hard to eat a sandwich.
Mhm,
that.
yes, you can do that too.
You want to add anything to that, Harpreet?
Yeah, so the muscle, the DAO, and the
Mhm.
muscle that pulls your lower lip just straight down, right? To
Yeah.
open your mouth, called the
Yeah.
DLI. So when you open your mouth really big, the DLI pulls your lips down, and the DAO pulls the corner of your lips down. And those two muscles live very, very, very close to each other, as Christelle was saying. And in some people, they kind of intertwine with each other. So although in anatomy books we look and they look like very well-defined muscles and, oh, I would just, put my Botox there. It doesn't work that way.
Mm.
They rest together sometimes with the fibers crossing. And
Mm-hmm.
depending on how you dilute your product and whether you're using Botox, whether you're using Dysport, whether you're using Xeomin, each
Mm-hmm.
of those products actually have a different diffusion, meaning that when you inject a particular volume, they affect a a predictable amount of tissue around it. So maybe it's 0.5 centimeters or 0.2 centimeters. And depending on how you dilute it, the dilution can cause the treatment area to spread or be bigger. And then so
Mm-hmm.
you can affect the DLI and the DAO. So you can affect a muscle you might not have intended to. And that
Mm-hmm.
can impact how wide you can open your mouth, or it can change the character of your smile. I
Mm-hmm.
would say that doesn't happen very, very often, but
No.
of the different things that can happen in Botox, that's one of the more common ones. So,
Yeah.
before a newer practitioner jumps into that treatment, they should feel very confident and comfortable with their anatomy, and they should feel comfortable with the dilutions they're using and how far the effect of that product is going to spread.
Mm-hmm.
So, it is a little trickier, to your point, than other areas that we treat.
It's one that I continue to feel whenever before I inject, just to
Oh,
really
yeah.
feel that muscle contracting because you want to be so precise with that injection point.
Yeah, I've watched both of you do that where you're, asking them to animate again, 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 again. Because yeah, nobody wants to have hit the DLI, that's for sure. Um, so let's say somebody feels like they look sad in the lower part of their face, or people are asking them that, what's wrong, that sort of thing. They come and see you, or they see us, and we start with that very minimal little treatment. And it's improved a bit, but it still hasn't really sort of hit the mark for them. It's something else other than the musculature. What maybe talk about what the most common sort of next, how do you assess? So is it the lips? Is it the chin? Because it
So
depends, right?
I tend to, lips is usually what I will do last. I tend to look at what we call the perioral area, so the entire area around the mouth and from different angles. And people often see me kind of walking from one side of the bed and the other side and up and down and staring at them for a long time to really understand what's going on. And we do know that as you age, the bones will shrink, so the chin will recess. But is there a lot of chin recession? Yes or no? And then closer to the mouth, that like just below your lips and above your lips, what will support the corners, often you'll lose volume there. So starting there often will have the biggest benefit. And then if there's still some loss there, you can put a bit of a hydration in the lips, but you may not necessarily need that much depending on the person. I don't know, Harpreet, how do you tend to approach that area?
Yeah, it's so individualized, right? So
Mhm.
I often will start with looking at muscle and muscle tone. So sometimes if people have shorter chins, they'll hold a bit of tension in their lower face. So you'll see pebbling of the chin and just a sort of tense sort of
Mhm.
affect when you look at the face. And then I'll look for shadowing, or what we
Mhm.
call the marionette line. That usually makes people look sad. And that shadowing can be from tone in the DAO that we already talked about, but it can also happen because they are losing volume and they're losing elasticity in their skin too.
Mhm.
So when we talk about um, shrinkage or volume loss, it's global. It's not just
Mhm.
in one area. Yes, the chin does shrink more so than other areas, but the entire skull shrinks. So if you
Mhm.
think about, a balloon losing air and the sheet over it, what happens to it? It starts to look a little bit saggy. So initially, when we get that saggy appearance, it starts with subtle shadowing at the corners of the mouth, what we call the marionette lines. And so that can give the impression of sadness too. So if that's a
Mhm.
contributor, we may look at dermal filler in areas that are not close to the area that the patient is
Mhm.
concerned about to just change structure and to improve the overall sort of visual impression. So it really is individualized. And then from there, I look at the volume at the corners of the mouth itself.
Mhm.
So oftentimes when people lose volume in the lips, there's a pattern to that too. You'll get global volume loss, but as we get older, we lose volume in the very corners of the mouth that can add to this sort of like downturning, but almost like a turning in of the lips, like turning,
Yeah.
turning under, like the lip sort of
Mhm.
turns under.
Yeah, they kind of
And
fold in on themselves
they
almost.
fold in on themselves. So that's a trickier uh, treatment. And
Mhm.
again, it's something that when you get experienced with lip um, dermal filler treatments, then you learn how to do the corners. So, yeah.
Yeah. I forgot to mention as well, and it came to mind when we were talking about the global assessment, that oftentimes that volume loss and that bone recession in the mid cheek can be what's contributing that those shadows down below. Really, when we're looking around, we're not just looking at the lower face, the one area, we're taking it all in. And oftentimes the support that's lost above, it tends to be the first contributing factor.
Yeah, it's a real art and a skill, I think, to be able to assess a face
Mhm.
properly. I think that's half of it. Well,
Mhm.
at least a third of it. Okay, part of it. But um, your eye sorts. I think the longer you do it and the better your eye gets, and it's easier to sort of pick those little
Mhm.
aspects out right away. It's always really interesting, I find, when doing a consult and we've done someone's photos, and we of course take pictures with various contractions of muscles, but the ones at rest, because nobody takes pictures like, right,
Yeah.
with their face completely flaccid. But when we do that and sort of we're able to cover certain areas, it's really exciting when they can sort of
Mhm.
see, like when it clicks for them. Yeah, I find that's just it's been
Yeah.
very helpful in terms of navigating people towards what might make them feel more like themselves, really.
Yeah.
Absolutely. And I think that people are uh, so motivated by those changes that they see in the mirror, especially when they've had life events that have been sad.
Mhm.
Definitely.
Yeah.
They don't want to be reminded of those events in the mirror. And that is often a huge motivator for people. They've had a loss or they've had some issue in their life that was sad and appropriately so. And it's okay to have that grief or those feelings. But over time, they really, really do not want to see that in the mirror. And so that's really nice when we can help improve that.
Yeah.
But it's a pretty common aspect to aging too, right?
It
So
is.
I
It
think
is.
as we enter perimenopause and menopausal years, I mean, that's one of the hardest things. There's a lot of loss in that stage. I feel like you sort of almost lose a little bit of who you were, who you are. It's like going through puberty all over again. It's horrible.
Yeah. It's a
Yeah.
time of shifting identities, right?
Big time.
Totally.
Which is why sometimes people do come to us not having done anything. They're not
Yeah.
in this Gen Z generation that
No.
is very used to taking agency over their looks. They've kind of grown up in an era where some of these things were looked down upon, but they're
Mhm.
going through this identity shift. And gosh darn it, they want some agency, they want some control. And
Yeah.
so that's what this podcast is about too. So, sharing information with you so that you
Mhm.
have that as a tool to make choices.
Mhm.
Yeah, and
Yeah.
to maybe have a better sort of understanding about what it is that's making you feel like you don't like the inside and the outside don't match,
Exactly.
See that
right?
dissonance we've talked about before, and sometimes it takes working on the inside first, then the outside. Other times it takes working on the outside first to help you get to the work on the inside. And there's always an interplay and a flow between the two. For those
Yeah.
who are listening, if you have a chance after the episode, maybe put in the comments if you've noticed any changes in your appearance and whether you've noticed feeling more angry or like you have that resting bee face, or is it more sadness that you've noticed recently? Would be interesting to find out which one you've noticed in yourself, and one more so than the other. I think personally for me, one of the first changes I noticed, but again, that's down to my anatomy, was that sadness in the corners of the mouth and maybe a little bit of the tiredness. What about you two?
Well, for me, I would say I tend to have a bit of an intense look to start with. And I would say that it was that intensity, right?
Mhm.
It tend to look more intense or maybe angry could be a word. Even though I'm Botoxed up, let me tell you, it's hard for me to frown. But um,
Amen.
but looking intense is something I've noticed, and that can be coming from a little bit of temple volume loss and other structures contributing to it.
I would say when I sort made the transition into medical aesthetics and the idea of considering an emotional attribute in terms of, I was clueless. I had never really even thought about whether I looked tired or sad or saggy or angry. I just circled all of them. When I read the questionnaire, I was like, I don't know. I need work, right?
It's
So
true.
I think
Sometimes
that's
it's hard.
people don't understand this stuff, and they don't necessarily think that. And I think that's the other thing that's kind of interesting is they'll come in and they'll ask to address a specific line, a specific spot, as if we just corrected that thing, they would feel like themselves again. And sometimes what I'll do is I'll, on their photos on the iPad, I'll just take my thumb or my finger and I'll cover that one line and I'll say, so this is better? You're this, and they'll either be like, yes, or more often than not, they'll be like, well, not really.
Yeah.
So, but I certainly had no kind of thought one way or the other about an emotional attribute until I did this work.
I think sometimes they don't even know. Like I've had a lot of people saying, I don't know what's wrong. Something's off. And I feel like I'm fading away a little bit. And I just don't like the change I'm noticing, but I can't put my finger on what that change is.
Yeah. And I don't sleep well anymore, and every joint in my body hurts, and and all of these things.
Yeah.
Yeah.
Well, I think these are tools, using different types of language to express to people what they might be seeing. Different things are going to resonate to other people, to certain people. For some, it's visual when we give them a diagram and say circle. That's going to resonate. For other people, talking about the emotional aspect of what they see in the mirror, that might resonate. And for other people, it's very structural. They might be very analytical, and they might come in saying it's around my eyes and it feels, and they might describe it in very structural ways. So really it's about understanding all of that, and then as a clinician, because you know what can address those concerns, using the right tools for that.
Would you say is it fair to say that often when there is an emotional attribute or a concern, that it is often associated with volume loss?
Well, I'm not sure that's true when it comes to anger, because oftentimes
Yeah.
that's muscular. I would say for sadness, it's a contributor. For resting bee face or looking harsh, that often is muscular as well. They might have tension in the mentalis, thin lips, so that part is structural. It might not be volume loss. I feel like we all come to the world with a certain aspect. Like I mentioned, I've always looked a little bit intense, right? So someone else might say, I've always kind of looked like a sad kid, right? So I don't think it's always 100% associated with volume loss. Some of it is how you activate your muscles, and some of it will be exacerbated by aging. I think we're ready to wrap it up.
I think we are ready to wrap it up. I think that covers the most of it. I think the take home for the lower face is that it is quite complicated what happens, and there's usually an overlap of multiple factors. Before we wrap it up, I did have one question that has now popped back into my head. We talked about Botox and fillers, but we're seeing a huge move towards regenerative aesthetics. Are there any regenerative tools that you would consider using in someone who doesn't want to do Botox or fillers?
For sad?
For sad.
I think that most people, when they come in with a specific complaint and it has to do with looking sad or angry, most of those people, their psychology is such that they want to see a more immediate change. That's just, they're, and a lot of our regenerative therapies require time and patience. And it takes 6 to 12 months to create collagen. And you will see an overall global improvement for people. but it takes a lot of time. And if you're coming in telling me you look sad and you don't like it, we may need to do something that works more quickly.
Yeah. Anything else to add?
Don't be sad.
Mhm. All
Just
right.
walk around grinning all the time. No, I think I think it's important to know, and I'm sure we've said it before at some point, that these changes happen to every single human being on the
Yeah.
planet that's lucky enough to live beyond
Middle age.
35, 45, 50. You know what I mean? Like,
Yeah.
there's nobody that's not going to notice these changes at some
Mhm.
point, unless
Yeah.
they're completely not self-aware. And those people are out there too. And I'm thinking ignorance is bliss. But sadly,
Yes,
now
and
I
if it
know too
doesn't bother
much.
you, then you don't need to do anything about it. But if you are feeling like
Exactly.
you wake up, you look in the mirror, and you just feel like you look sad, but you don't feel sad, we have a few tools that we can use for that. Next
We
time,
certainly do.
to the saggy look. So stay tuned. And if you like today's episode, let us know and subscribe so that you don't miss any future episodes. Until next time.
Bye for now.
Bye.
Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on the Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at H. Lotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.